Hi, good afternoon, everyone. Good to see everyone here today. I know a lot of people are still coming in from the waiting room. Um, Happy June. Hard to believe that summer is here. For those of you who may be new to these calls and don't know me, I'm Emily Beauregard. I'm the director of Kentucky Voices for Health and a member of the Thrive Kentucky campaign. And we can go to the next slide, Alex. I know most of you are familiar with Thrive Kentucky. For those of you who may be joining us for the first time, our mission is to meet the basic needs of every Kentuckian through systemic change because we recognize that many of our fellow Kentuckians have faced historical and systemic barriers to meeting their basic needs. And so we've put together guiding principles to really guide the advocacy work that we do as a group of partners. And you can see what those principles are on this slide. A couple of examples that really apply specifically to the work that we do with the Cabinet for Health and Family Services are those two top bullets, utilizing a welcome mat approach to the folks that are in need of assistance and making sure that we make it easy to access the benefits that people need and not, without those unnecessary barriers. And then integrating the eligibility and application and enrollment processes so that it's a more seamless and easier sort of system for people to navigate. So just some examples. You'll get these slides. You'll be able to read through it all on your own time, but that's some of the work that we've really focused on with the Cabinet for Health and Family Services specifically. And we have a number of partners that are part of Thrive Kentucky. You can see links to their websites here if you want to learn more about any of our particular organizations. We can go to the next slide. We always want to thank our sponsors for making this work possible, and particularly for the ability to offer these webinars, these forums, as well as a roadshow that I'll talk about in a minute for free, and covering CEUs for certified community health workers and for social workers and others who can do it independently. It really makes a difference for us to be able to have these resources to be able to provide these different programs. And if anybody is interested in sponsoring, we are still taking new sponsorships. You're welcome to reach out to us. Kelly on our team is the person to email with any requests for information. So you can, and I think Kelly will probably put her email in the chat. We can go to the next slide. I mentioned a roadshow that we are doing. This is the third or fourth year, I think maybe the fourth, that we have started to go to different communities around the state, right after the legislative session is over, and provide a more comprehensive update about, the current policy advocacy sort of landscape in Kentucky, our safety net, the different programs and resources that Kentuckians need to thrive. And we do this in addition to some advocacy training so that people who are working, boots on the ground in your community, serving your neighbors, really have the information that you need and the resources that you need at your fingertips to provide the best services to your community and to be the best advocates that you can be for your communities. And so this is a 3-hour program that we're doing between our first being in May and our last in November for this year. And we'll be going to every corner of the Commonwealth. We would love for you all to join us. You can see registration links here and get more information at our roadshow landing page. And if you've already attended one and thought it was useful, please share with your colleagues. But we hope to see you at one of these in the near future. We can go to the next slide. All right, so this is the agenda that we're going to be covering this afternoon. We're going to be talking with the Cabinet for Health and Family Services about their plans to implement some of the laws passed during the 2024 legislative session, and also preparations that are underway for the interim session that starts this month. We'll be sharing some updates related to public health, Medicaid, summer EBT, and WIC. And to discuss all of these topics with us, we're really delighted to have on our call today Cabinet for Health and Family Services Secretary Eric Friedlander, Deputy Secretary Carrie Banahan, Medicaid Commissioner Lisa Lee, Medicaid Senior Deputy Commissioner Veronica Judy Cecil, Medicaid Deputy Commissioner Leslie Hoffman, Director for the Division of Long-Term Services and Supports Pam Smith, Director of the Division of Family Support Todd Trapp, Division of Child Care actually, this is, I don't believe that Andrea Day is going to join us today. Department for Public Health Deputy Commissioner Dr. Connie White and Viral Hepatitis Program Epidemiologist Claire Holliday. So great to have so many of the cabinet's leaders with us today. As always, our goal with these forums is to create more dialogue between the cabinet leadership, consumers, and advocates. We really want these webinars to be an opportunity for you to get updates on our safety net programs, share feedback with the cabinet, and also have the chance to ask questions. So during each section, be sure to put any questions or comments that you have in the chat as we go, and we're going to try to cover those as we go rather than waiting until the end of a particular section. And before we begin, just a little bit of housekeeping. We have a lot of folks on the webinar today. Please be sure to mute your line and use that chat box as much as you can for any comments or questions. We are recording the webinar and we'll be sending out the recording and any materials along with an evaluation and a follow-up email, so you can watch for that tomorrow. And I mentioned CEUs. If you are a certified CHW or a licensed social worker and you'd like to receive CEUs for attending today's webinar, please be sure to complete the evaluation that we send out in that follow-up email. All right, and with that, I'm going to pass it to Dr. Sheila Schuster to get us started.
Thank you very much, Emily, and good afternoon to you all. I'm Sheila Schuster. I'm a licensed psychologist and the executive director of the Advocacy Action Network. We do advocacy around mental health and substance use disorder issues, and we also do advocacy around disabilities and access to health care. So I want to do a very brief summary of the session that we just ended, the 2024 General Assembly session. You all may remember that it was at times it seemed like a very, very long session. The 60-day session, it began on January 2nd, and then adjourned sine die on April 15th. The legislators filed over 1,200 bills, and 223 of them became law. Interestingly, the majority of them actually got final passage in about a 5-day span just before the veto period started. The governor vetoed 44 of the bills, but the legislature overrode or overturned all of his vetoes. Bills would become law on July 15th, unless they were passed with an emergency clause, and there were a few of those. The first responsibility of the long session legislature is to pass a biennial or 2-year budget, and it was a little bit different this year because it was spread over several pieces of legislation: House Bill 1, House Bill 6, House Bill 264. And we're going to delve into that in just a minute. Your best source of information always is www.legislature.ky.gov. And if you click on bills and then the 2024 regular session, and then you can click on either Senate bills or House bills, and all of the numbered bills are there. If you click on any number of a bill that you're interested in, it will tell you what happened to that bill during the course of the session. Did it get any action? Did it pass one chamber? Did it pass both chambers? Was it changed along the way? Was it put into law with the governor's signature or without his signature or over his veto? I want to talk a little bit about the interim session because it just started yesterday. So we had a brief break from April 15th to June 4th, 3rd, I guess. And the interim meets from June 1st to early December. So people are like, why do we have an interim? Because they can't actually take any action. They can't pass legislation. And while that's true, this is a great time to be in touch with your legislators because the pace in Frankfurt is certainly much slower than it is during a regular session. They look at issues to take some time to study them in greater depth. They revisit issues from the previous session, and they like to preview issues likely to be heard in the upcoming or 2025 session. So if you have something that you're working on and you're working with a legislator, you might talk to them about the possibility of presenting that topic in one of the interim joint committees. The House and Senate committees meet jointly once per month. So for instance, the House Health Services Committee We'll meet jointly with the Senate Health Services Committee once a month. And again, it's a great time to vet an issue because you could do it with both House and Senate committee members at the same time. The interim calendar is posted on that LRC webpage that I just gave you, www.legislature.ky.gov. It's in a box at the bottom of the front page. My suggestion to you is that you check it often because the interim schedule changes very frequently. We have special committees or task forces, and those were just named. They will study a single topic in depth and then make recommendations for future action, possibly to be considered in the upcoming session. So the task forces are, there's one on the oversight of the Cabinet for Health and Family Services. There's one on school district governance. There's one on talent attraction and workforce issues. There's one on artificial intelligence, and then there's one on called the Kentucky Housing Task Force. And those dates have not yet been set, so that's why I suggest that you check frequently on the LRC website. In future forums and so forth, we'll be posting that meeting schedule for those task forces. And finally, I want to remind you that 2024 is an election year. The primary election was held on May 21st, and the general election will be held on November 5th, with the deadline for registration on October 7th. As we know, every vote is important, but I would point out that one of those races was decided by 5 votes. So one of the candidates beat the challenger by 5 votes in order to continue on to the general election. Another one of our incumbent legislators defeated their challenger by 84 votes. So when we say every vote counts, we really are serious about that. Every vote counts and elections do matter. So keep that in mind as we go along. So I want to turn to the first thing we talked about, the budget and its importance. And I'd like to call on either Secretary Friedlander or Commissioner Lee to talk to us a little bit about how Medicaid fared in this budget that was just passed.
Okay, thank you, Dr. Schuster. So the budget is for 2 years, 25 and 26. And the good news is that Medicaid's base was fully funded, so we can continue to operate as we currently do. We had other good news in that there were several waiver slots added to our budget that we'll be able to implement in 25 and 26. I think that's very good news. So we look forward to continuing our operations as we go forward. I appreciate the General Assembly fully funding our budget as we currently stand.
Well, we are very happy about that as well, Commissioner Lee. We were concerned, and I think actually the budget ended up being split in 2 different bills, but you did get full funding of the base budget in Medicaid, so we're very excited about that. I'd like to turn to mobile crisis implementation. I believe that Leslie Hoffman is going to address that. This is a program that was rolled out or announced anyway by the cabinet that would involve a coordination across the state for addressing crises of a behavioral health kind and coordinating also with 911 crisis response.
Yeah. Dr. Schuster, as we talked a little bit about the budget, the one thing that was not in our budget is mobile crisis. It was not funded, so we cannot implement.
Okay. So is there anything that's happening at all with mobile crisis at this point?
No, we did not have funding, so we cannot implement.
Okay. All right. One of the bills that passed right toward the end of the session was a bill that we had all been very excited about. It was House Bill 10. It was called the Omnibus Bill, sponsored by House Member Representative Kim Moser, who is the chair of the House Health Services Committee. And it has a number of different pieces to it. It was actually passed after the veto period as part of Senate Bill 74. So if you are checking your bills to see about House Bill 10, you won't find that it passed, but it actually did pass. So it got incorporated into Senate Bill 74, and that's where you will find that language. So I think Commissioner Lee, you and Dr. White from Public Health, we're going to talk about some of the various pieces here, the lactation coverage, the special enrollment lifeline for moms, which those of us in behavioral health are particularly excited about. And then some expansion of the HANDS program as well.
So I can go first, Dr. White, and then I'll turn it over to you to talk about some of those other provisions. The one thing that is in there that we're really excited about too is the expansion of eligibility for pregnant women up to 218% of the federal poverty level. That's the current level for our Kentucky Children's Health Insurance Program, which is CHIP. So we can cover pregnant women in our CHIP program. And again, that's up to 218% of the federal poverty level. There is also an open enrollment period. Like pregnancy now qualifies as a qualifying event for open enrollment outside. Medicaid always, of course, has enrollment. You can enroll in Medicaid at any time. But for those products out on the exchange, for example, pregnancy is considered a qualifying event in July, and individuals who become pregnant will be able to apply for a product on our state-based exchange. So that I think those are really good, two really good provisions in that bill that are going to help us make sure that pregnant women get the services that they need early on. And I can turn it over to Dr. White for any other comments that she has on the Omnibus bill.
Thank you, Commissioner Lee. I did want to say at the very beginning, I'm not in prison. I am at Lake Cumberland State Park. And so I'm just getting a little bit of the sun coming through the window here. Yes, we're very excited about this work in the Omnibus bill. Two things I wanted to cover. One is the updates to HANDS. So what that bill has done is helped codify work in our HANDS program to be sure that we are emphasizing safe sleep because of the risk of infant death because of unsafe sleep conditions of our babies in Kentucky. They will be doing more work with breastfeeding information and helping to navigate people to breastfeeding lactation consultants or whatever is available in their community, and also helping to codify our telehealth visits. We did HANDS all through telehealth, telephonically during COVID. Those visits were successful. So we are now going to be able to use that depending on what's best for our patients at the time of service. So those are exciting things. The other thing is the Lifeline for Moms that Dr. Schuster was talking about. That's in the very, very early growing stages. We were able to, at the cabinet, to get a grant to help us build this. This will be a hotline for providers. So I'm an old OB doctor. So if a patient came in to see me postpartum or anytime during their pregnancy and I felt they were having a mental health crisis, if I did not know how to treat that person, I will have access to a perinatal psychiatrist or a psychologist who I can consult with that will help me understand how to best treat this patient. We know that perinatal mental health is a huge problem in Kentucky, so we want to respond to our pregnant persons and give them their providers the help that they need. This won't just be obstetricians, it will be nurse midwives. We'll be reaching out to family practice physicians who might see that patient 6 months postpartum, and we'll be reaching out to our pediatricians because often the caregiver brings that baby into the pediatrician or the family practitioner who's seeing that baby for a well baby check, and they sense there's a problem. So we really want to span all of the caregivers in Kentucky that might have contact with this person and be sure that we get them the best quality care at that time. So those are the two things that I'm working with on this. Thank you, Dr. Schuster.
Yes, thank you, Dr. White. I assumed that Lifeline would also be available for the dad. We know that about 10% of the new dads also have perinatal mood and anxiety disorders. And I'm assuming that if the provider was concerned about the father, there would also be that access to the Lifeline.
Right, yes. Whatever provider sees that person, that caregiver, then they would be able to contact a healthcare professional that has special training in perinatal mental health. And so we're very excited about that being an opportunity as well.
Yes, and we had done some work 2 years ago with Senate Bill 135 to create a task force to look at trying to train more behavioral health providers. Because I don't know that we don't have enough, certainly.
Well,
That
Senate
need-
Bill 135 that you're talking about, we in the cabinet are having those meetings regularly. We pull together people from all across the state and a lot of different walks of life. It's been interesting. Some of them didn't know about each other. So we've been able to connect them in a way they weren't connected before. And they have agreed to help us as an advisory committee for this hotline project. So we're mainly, like I said, I'm an OB doctor, so I need people that their swim lane is mental health, perinatal mental health. So we're reaching out to that group. So we're using that Senate Bill 135 group from last legislative session to help us with this project because there's no need in bringing another advisory group together. We've already got those experts that we are developing a relationship to help us with that. So it's a very exciting way that all this legislation is fitting together.
Yeah. And finally, I guess I would point out that we've been concerned about racial disparities in the state, not just in Kentucky, but across the country in terms of Black and brown moms having more difficulty, even sometimes resulting in more deaths of pregnant moms and birthing moms. So I'm hoping that this work is going to certainly address some of those inequities as well.
A CDC grant that we have with our Perinatal Quality Collaborative here at the Department for Public Health we've just gotten funding, and within the last week we have hired a health equity coordinator that's going to help us in all of our different projects that we're doing in the perinatal world, mental health, as well as the other things that we're doing. So it's a very exciting time.
Yeah, it really is. Thank you so much. Appreciate that update. And now we'll turn to more good news. There was a group that worked with the 874K Disabilities Coalition called ARMS, Advocates Restoring Medicaid Services. And their cry actually was to get many, many more waiver slots funded because of the long waiting list. So this budget saw 1,925 new waiver slots that are allocated across the Michelle P., the home and community-based, the supports for community living, and the acquired brain injury waivers. So we are so excited about that. And I know that Pam Smith from the cabinet is also very excited about it. But you have a lot of work to do, Pam. The budget language calls for the cabinet to report in October how those slots are being assessed and how they will be allocated. So we're anxious to hear about that.
We're anxious to share. And the good thing was we had already, wait list had been something that we were concerned about and had been looking at, and we had already got a fairly good jump start in doing an assessment. And I know several people, even on this call, have been part of some of the work groups and stakeholder engagement that we've done on waitlist as we've talked about that over the past several weeks, and really for longer than that. But we are very excited to watch the programs grow, and because to us, it just means we're serving more people in the communities where they want to live and where they choose to remain.
So how will you go about meeting that deadline, Pam? I know that you're using some of the Department for Behavioral Health, Developmental, and Intellectual Disabilities expertise and staff to help with that.
It is a true cross-cabinet effort. So we, all of the sister agencies, we are working together, and we, as I said, we are beginning, we had started looking at those even beforehand. As long as we've had wait lists, we've looked at that. We're talking right now to other states, and we're working really together and planning, kind of what our attack is going to be to make sure we meet that deadline.
And can you talk a little bit, because people, I think, may not be as clear on how the slots get filled. If a slot becomes available at a given waiver, can it be filled immediately, or is there a time frame for filling that?
So the slots So right now, we have actually already received approval from CMS. So as you know, or people have heard us mention that once we get the funding for the slots in the budget, then we have to put it in our waiver applications. We worked with CMS. We've already submitted the waivers and already have approval back for the slots that begin being funded on July 1st. So we will, so we already have got that step over with. So once we allocate a slot, an individual has a period of time to request the assessment. So to be assessed, to have that level of care and to initiate starting those services. Typically that is 60 days. We do work with individuals though, because things happen. Sometimes you can't get, you know, you can't get that schedule. Sometimes you get sick. So we don't hold always strictly to that 60 days. So we work with individuals who can't get that assessment done within that initial 60 days. Most times it can happen. You know, we have staff that, for example, with HCB, we have an assessors group that does those assessments. So they, you know, reach out as soon as the slot's allocated, reach out and begin trying to schedule. Our CMHCs do the same thing for the Michelle P slots, and then we have our CIS assessors for SCL. So we work, you know, as soon as we notify an individual that that slot is theirs, then they can go ahead and start the process for getting that level of care and initiating it to get services. So they get level of care first, and once level of care is established, then they'll get to pick a case manager, because as you know, person-centered choice is the foundation of these waivers, and that the person, you know, that they get to make the choices and participate in their team meeting with whatever support that they need. They will choose that case manager then that will help them to begin to actually access services.
Right, okay. Well, it's a very exciting time, and before I turn it over to Kelly, I just want to point out that the other good news in the budget was the funding that the legislature put in there for other waivers that are pending. They're in various stages of being submitted to CMS, and that includes several waivers around people with severe mental illness and people with substance use disorders, and a reentry waiver that we're going to talk about here in a little bit, but also a waiver that we've been working on for a lot of years, in my case, 1915I state plan amendment to look at supported housing for our people with severe mental illness. So the good news is that the legislators heard us, and they put the funding in to bring down the federal match and get us ready as soon as CMS approves those, and we can start implementing. So this is a great time for people who are in need of waiver services, probably the best time that I can remember in the last, I don't know, 15 or 20 years. I think it's a time of great progress and great hope for our people with significant disabilities. And we thank all the people at the cabinet that have worked so hard on those waivers, and wish you well in getting your report ready in October and moving these things once they're approved by CMS. So with that, I will turn it over to Kelly to talk about public health and immunizations, and thanks very much.
Before I segue us away too far, we do have a couple of questions in the chat. One is specific to if a person contacts you within a few days left of their 60 days to pick a case manager, even after the 60 days, what does the case management agency need to do to ensure the person still has a slot? This is a specific question for HCB participant directed services, PDS.
So they just need to reach out. They can reach out to the HCB waiver help desk. And I'll put in the chat, I'll put the information for the HCB help desk, as well as our Department for Aging and Independent Living that helps, that administers participant directed services. I'll put their contact information there. But if they find themselves running into that situation, they can reach out to either of those help desks, and they can help them to navigate through that, because we don't want somebody to come up on a deadline and they're ready to start services or ready to access services. We don't want to see them not get to access those services. So we'll do whatever to help them get through that.
Perfect. And then the second question we had was about, was there a specific number of slots given as to what would be available July 1st? Do we know that number?
So we were given in each of the 4 waivers where slots were funded. So for Michelle P, we have 250 slots, 125 for SCL, 250 for HCBS, and 25 for ABI long-term care. But I will caveat right now, we do not have a wait list for ABI long-term care. We will not just automatically dump all of the slots into the system or allocate all of them at one time, because that just creates a different problem. So you go from people waiting to have a slot to people waiting to get assessed and waiting to get services. So one of the steps we're taking right now is assessing provider network, really working with the providers to find out who is on board, can accept new participants, what areas we have them in, where do we have potential gaps that we need to look at, providers, and then we will release those, on a rolling basis, so that we do not overwhelm the system with, assessments that need to be completed and then getting people started. So as quickly as we can allocate the slots, we will, but we don't want to go from people waiting on one spot for a slot to them waiting in line to get an assessment or waiting in line to get services. And so we'll monitor that very closely as the process, as we go through the process and as we begin allocating. But the biggest hurdle was making sure we had that approval from CMS, which we do. So we don't have to wait. We don't have to wait for that part.
Great. Thank you, Pam.
You're welcome.
I'm going to segue us into some public health speak now, and I should have introduced myself. I apologize. Kelly Talby with Kentucky Voices for Health. To kind of pattern on the same flow that Dr. Schuster just presented in, another success of this legislative session was the rollout and soon to be implementation of the Kentucky PrEP Act. This is a reflection of the pandemic. With as much hardship and tragedy as it brought, it also forced our hand in some new technical best practices. And the federal Emergency Preparedness and Readiness Act allowed pharmacists throughout the state to immunize down to the age of 3. Kentucky's PrEP Act is a compromise among providers to implement down to the age of 5. And I'm going to hand it over to Dr. White to talk about that a little bit more, as well as some other immunization tools, because public health is public safety. The more we can keep our children immunized and available to the resources that our Department for Public Health has for them, the better and safer all of our communities are. So Dr. White, I'll let you take it from there for a minute. You are muted, Deputy Commissioner.
I was so proud that I was able to share my slides seamlessly, quickly, and then I can't turn my microphone on. All right, so you can see those now. All right, terrific. So PrEP Act that Kelly was just talking about, House Bill 274, it was sent to the governor on March the 25th by the Speaker and the President, and the governor signed it the next day. And as Kelly said, it allows licensed pharmacists to give the ACIP, the Advisory Committee for Immunization Practices. These are the generally accepted recommendations of what immunizations children should get. It's a CDC group. We are now the 13th state that's made progress toward this, and we're very proud that this work has happened. I'm going to talk really fast, and I'm doing this because you will have access to the slides, so you don't have to take pictures or write anything down. This will all be available to you. I've got a lot to cover, and I want to give a large amount of time to Claire Holliday, who's our subject matter expert on hepatitis C and our viral hepatitis program. I want to make sure all of you out there, you know we have an immunization registry. It's very vital for providers to be able to go in and see, have you had a vaccination? Are you due any vaccinations? When was your last vaccination? If we don't have providers putting that in electronically, we can't share that. So this is an opportunity with the Foundation for Healthy Kentucky and our Kentucky Department for Public Health. There are funds available to help you get that electronic connection done up to $10,000. So you'll get this. You'll be able to Google that Foundation for Healthy Kentucky and the Kentucky Department for Public Health and see if you can qualify for that. We are very encouraging. The more information we have, the better we can care for our patients. This is a screenshot of our immunization outreach page. I found this by Googling immunization plus Kentucky, and I got this page. I just want to bring your attention to certain things. We're not going to go into depth with them, but I just want you to know what's available and what we are trying to share with all of you out there. The vaccination schedules, if you go to that little area that I've highlighted in yellow, it's got adult vaccinations, childhood vaccinations, all of those schedules. You click on that, you're going to get a nice PDF of those things. Down here at the bottom, we've worked very hard at some social media graphics and things for tweet and Twitter and all of those things that I don't do, but I know they're important, and it's a very important way for you to send this message. As Kelly said, we have to keep our littlest Kentuckians healthy, and we want to make sure that families and support people know the importance of these vaccinations. Further on down the page, there's a back to school toolkit that I want to make sure you see. And this just goes through all of the different grades, and all of those are live links if you go to the website. Sorry, this is a screenshot, but if you go to the website, all of that information is available for you at your fingertips. Also on this page, this is something that's kind of new, and I don't think we've even talked about this with Kentucky Voices for Health, the Early Childhood Milestones brochure. This brochure, if you use the QR code and you can download this, there's an app, and you can put all of your children in there. Up to 5 children can be entered into this app, and it will tell you their milestones, when they should be walking and talking and setting up and doing all those things that kids should be doing. And it also tells you when they should be getting which vaccines. So the other side of this piece of paper, this just shows you start here, and everywhere there's a star, that means that there's a vaccination recommendation, and it goes all the way up to 5 years. This is available on that website, free for you to load and use, because it's a lot of information for people to try to remember on their own. This is a tool that will help you to be sure that none of those things are missed, and you can have conversations with your provider if you're confused about maybe my child isn't where they need to be. This is a guide to help you and your provider discuss that. This is our perinatal hepatitis page. Again, I Googled perinatal hepatitis plus Kentucky and came to that page. And up here where I've got in yellow is our hepatitis outreach tool. This is what that looks like. This is everything from the providers wanting to have information, the birthing hospitals, letters that you can send if you are a health department or a provider to your family members. This is a wealth of information here, again, at your fingertips, and you can click through that and find a lot of ways to, because hepatitis B is a huge emphasis we're trying to make for our infants. We can treat these children in the newborn nursery. We can help to wipe out hepatitis B in our Commonwealth. I'm now going to go and share my time with Claire Holiday, who's going to talk about hepatitis C. My email information is the first slide you didn't see, so you can always contact me about any questions you have. But if you go to the website, you're going to find a wealth of information. Thanks a lot, Kelly. Take it away, Claire.
Okay. Can you all see? I don't think I'm in presenter mode, but can you all see my slide?
Yes.
Okay, excellent. So my name is Claire Holiday. I'm an epidemiologist in the viral hepatitis program at the Kentucky Department for Public Health. And really, this is just going to be a brief overview of where we're at with hepatitis C in the state, and kind of the burden of disease that we're facing, and then some recent testing recommendations that have been updated over the last few years. We're trying to get the word out about these updates so that providers and the general public are aware. So really on this first slide, we're looking at the rates of acute hepatitis C from 2015 to 2022. You'll notice the US rate is on the bottom and Kentucky's on the top. Our rates have continued to climb over the past 5 years, which is alarming. Another reason is alarming, hepatitis C, although it is not vaccine preventable, there is a cure for treatment. So The fact that the rates keep going up, that is not great news for us as a state. And another piece of information you can't tell from this slide, we are a high burden state compared to other states in the United States. Traditionally, we have been one of the top 5 states for hepatitis C over the past 10 years. We're a high burden state and our rates continue to rise, which is actually very different than what other states are facing. They are high burden states and their rates are slowly declining. So that is something I always like to point out, just to keep in mind the landscape of hepatitis C. And then my next, oops, let's see here. Okay, and then for the testing recommendations, so actually some of these have been out for a few years now. The universal hepatitis C testing recommendation, I believe that first came out in 2020, which was greatly eclipsed by the pandemic. But that really is just to emphasize all adults 18 and over should be getting at least a one-time screening for hepatitis C. For clinicians, if any clinicians are here today, that traditionally starts with an antibody test. And if that test is positive, it will be reflexed to an RNA test for confirmation of active infection. And then to go along with those screening recommendations, really for any adult that exhibits or participates in some of those riskier behaviors, we want them to be tested more frequently. And another update to those testing recommendations is each pregnant person should be tested during each pregnancy. And then finally, the newest recommendation updates came fall of 2023, and that is for our perinatal hepatitis C. So infants who are exposed to hepatitis through their mother in utero or during birth, it is recommended they receive testing between 2 and 6 months of age. So that is a new recommendation for us. We're trying to push that information out to the public, general public and providers. And then finally, for treatment, hepatitis C is treatable and curable with direct acting antivirals. And it is between an 8 and 12-week regimen. And so lots of providers are able to give this treatment to their patients. And we know that people oftentimes get tested in community and are needing treatment, and they need to seek treatment elsewhere just due to the nature of where they were tested. So in those situations, the CDC has put together a pretty helpful tool. It's a treatment locator widget, and it has identified providers who are able and willing to treat hepatitis C, and it has that down to the zip code level. So we use that all the time to help assist. Often it's local health departments that have reached out to us when they are not certain of providers or locations that they would be able to access for treatment for their patients. So again, that's a very helpful tool. It's included on this slide. And if anyone is interested, I can also drop that link in the chat as well. And then finally, if anyone on this call, or if you know of others who need help with viral hepatitis, our program information is listed here. We have a group email, vhp@ky.gov. I'm an epidemiologist, and we have another epi on the call for hepatitis. Data requests, we get those often. Please feel free to send us a data request if that would be helpful for your grants or any other, anything like that. So that really is it for me today, and thank you for inviting me.
Thank you so much, Claire. I'll pass the mic over to Priscilla here in a second, but just to kind of close out, we started that one on here's everything you need to know about vaccine preventable disease, to here's a situation where we don't have a vaccine to prevent hepatitis C, but like Claire said, it's extremely treatable, it's extremely curable, and yet 54 of the country's 220 high-risk counties are in Kentucky. We've got to make a more concerted effort. So if you are working with the pregnant population, if you're working with the reentry population, or if you have colleagues or others in your communities who do, please pull up Claire's resources because there's a lot of, like she said, by the zip code, get you a treatment provider. We can definitely make an impact there. And so with that, I'm going to pass the virtual mic over to Priscilla Easterling.
Thanks, Kelly. Sorry. Hi, everyone. I'm Priscilla Easterling. I'm the Director of Outreach and Enrollment for Kentucky Voices for Health. And today we're going to cover some very exciting Medicaid updates. So I'm going to go a little out of order just to keep things running smoothly. And we're going to start with an update from Pam Smith about our 1915I waiver. And Pam, if you can give just a little update about what the waiver, about what that waiver is, what it includes, and where we are with that, that'd be wonderful.
I'm happy to do that. So we are very excited, as Dr. Schuster referenced. We've been working on this for a long time in Kentucky, but we have submitted a 1915I state plan amendment. So it's for us, it looks very much like a waiver. It functions like a waiver, but it actually is a state plan amendment. We're trying to train ourselves to say that, but I still end up saying waiver. But it supports individuals with serious mental illness and some individuals also with substance use disorder. It provides some services to support individuals in the community. Those include various levels of residential supports, as well as some assistance with technology, with transportation, with navigating the community or their supports that they would need in the community, and as well as respite is one of the other services that, and if anybody knows me, respite's one of my soapbox services, because if we don't take care of our caregivers, they can't be caregivers. So it also includes that service. We are so excited for this waiver to roll out. We had an initial conversation with CMS last week. We have a subsequent conversation with them scheduled for this Friday to talk about, they had a few additional questions they wanted to ask us before they send back to us what's called a informal request for additional information, which to us means it is moving through the process with CMS. So it is going through their review process. We're very excited to get it back and hear what questions that they have. In the meantime, what are we doing? We are working with our partners in behavioral health and looking at the types of providers that will provide these services. What is it going to look like to certify these providers? What do we do to ensure we're going to have a network of these providers? We're looking at what kind of education do we need for the providers? What kind of education do we need for families and for members who will be seeking these services, to make sure that once we have everything aligned and it is approved by CMS, that we can hit the ground running and get started serving individuals. But very, very excited for this opportunity for Kentucky.
Yes, that's a wonderful update. I'm so excited too. Is there, I know it still has to work through the process, but is there a timeline that you're thinking that maybe of implementation or when it might be approved?
So CMS, we're right now on their clock. So, and they have 90 days. So while things go back and forth, it stays on that clock. So really, we're kind of held hostage to that to determine what the final timeline is going to look like until we work through these last parts with them. Although very hopeful that we will see when we talk to them Friday and we get that request for information back, that we'll see what we need to do and where we need to go. Once that happens, then we can kind of set out a more a firm timeline that we will be sure that we share. One of the things that we've tried to do throughout this process is be as transparent as possible and get as much stakeholder feedback as possible. So we'll make sure as soon as we can share more information that we have that out there and that we are sharing it.
Awesome. I love that. More curiosity, what are the follow-up questions that CMS had for y'all?
We do not. So one thing was an easy thing, and I'll be, I am transparent to a fault sometimes, I guess. One of them is we made a typo. We had a copy and paste error. So that's a real easy win and fix for us. So we've already noted that down, and as soon as we get it back, we will fix that. That was really easy. The other things, honestly, they haven't really given us enough detail yet for me to even really speculate what the questions are going to be. So that's why I'm very anxious for this meeting Friday, but also looking forward to it. Our group with CMS that we work with has been very excited for us to see us, the progress that we've made. They're excited for us to implement these services. So they've been great. They have been great to work with.
Awesome. I love that. And so Friday is when you'll know more about what their questions were.
We
and
should know, yes,
Okay.
and when we should get
Gotcha.
that I should expect that actual email with that written document in it. We should know that by Friday afternoon when we talk to them.
Awesome. That's very exciting. Well, is there anything else that you'd like to share about the 1915I or anything that anyone on the call can do to be involved, or any feedback at this point? Anything else that they can do?
No, at this point, I think everyone has been so helpful so far. Dr. Schuster, I would really like to thank you. You've been very involved, and thank you for your input. And we will let everybody know as soon as we have information that we can share, and what our next, what the next steps are, and how we, as we move forward.
We're very excited that we had 84 individuals that submitted comments about that 1915I SPA before it went back to CMS, and that's a tremendous amount of participation, and most of those were consumers and family members and advocates of providers, so people that were really intimately familiar with it. I think there were 7 or 8 other organizations. So we've had lots and lots of input, and we appreciate the town hall meetings and other things that the cabinet has done. Thank you, Pam and Leslie.
Thank you.
Thank you. All right, well, then let's transition over to our reentry waiver, the 1115 reentry, and we have Leslie Hoffman here to talk about it. Can you also do a quick rundown of what's included in it, where we are, what the timeline looks like?
I can. I would just like to mention, based on what Pam just said for that 1915I state plan amendment, just a reminder, we do have a companion 1115 SMI to meet all the needs that we heard Kentucky's voices say, this is what we need. So that one's been pending with CMS since May. So last May of last year. So I just wanted to let you know, and it's kind of tied up in our extension and renewal. So fingers crossed that that's going to be coming soon. So you all have heard me talk a lot about the reentry waiver. Very exciting. It is finally moving. And can I share my screen? Would that be okay? Just real quick.
Yes, absolutely.
People can see things that sometimes it's more tangible to have, and they can print. I can share this with you. So right now, currently where we are with CMS, we have a hopeful approval date of very soon, because they had so many states that started flooding, especially during the COVID time period, with state plan amendments and also with the 1115 amendments. They've tried to figure out a way of how to expedite states that are in certain stages. So based on when the application came in, whether the reentry waiver, which ours was part of a larger extension, because that goes along with our Team Kentucky overarching 1115 for the state of Kentucky, and then when the state's demonstration expires. So because of those 3 things, we were very lucky. As you can see, we are in cohort 1. We are number 1 of 4 states that will be going through the first approval process. So we're very excited. The only thing that's been a little bit hard, and it's not been hard to answer the questions, it's just moving fast, right? So we have to stay very much on track with any questions they ask so that we stay on that expedited procedure. So if you can see here, we're in the first 4, cohort 1. And just to go over a little bit here, just wanted to let you know, lots of questions that haven't been hard questions. It's just been timing to get them in. Questions with CMS, we turn those right around. I just got a email while we've been on this call that said we're in good standing and they have nothing else further. That doesn't mean they might not come up with something tomorrow, but today we have no further information back to them. Most of it's been budget neutrality stuff. Tell us how you came up with this number. What was your per member per month? How did you calculate that? Was this based on a, like an increase rollout, or was it what you expected at the highest level of participation? So nothing real hard. It's just taking time to get them back. Did want to just mention, and many of you all on this call already participate, we have an ACRES work group that is a governance committee, and that's where we are in our time frame with the reentry waiver. We have what we call it stands for Kentucky Advisory and Community Collaboration for Reentry Services work group, and many of you all participate on that. And it's so that everybody has a voice at the table to help us during the whole implementation process. So just a reminder too, that once CMS approves it, which we hope They said second quarter of calendar year, not a fiscal year or a federal year. So we're hoping to have an approval in hand before July 1 is what we're really hoping for. But once they say, hey, Kentucky, you're approved, there's much more in 1115 you have to do. We'll have to develop an implementation plan. This is the first 1115 opportunity, and I don't want to go in too deep because it's hard to understand. There's a reinvestment opportunity that we will work through. There's partnerships on IT, assistive technology that we can, not assistive technology, IT technology with DOC and with DJJ, our partners in this. There will have to be a monitoring plan that they approve and an evaluation, a plan that we will say, this is how we're going to evaluate, and do you approve what we call our STCs, or our standard terms of conditions, which you'll see on this slide. Another thing that I wanted to tell you all that we're very proud of, we applied for a NASHP, which is the National Academy for State Health Policy, and HARP, which is the Health Reentry Project. We applied to be part of a very exclusive little group that's doing a state reentry learning collaborative. They had an overwhelming response in applications, and proud to say that we were one of the 5 that were chosen. So we're very excited about that. We will be taking off to Washington, D.C. on the 20th for the kickoff, the 20th and the 21st. For Medicaid, it'll be Angela Sparrow and myself. We have Dr. Marks going, Dr. White going from DJJ, or sorry, Commissioner White, Commissioner Cruz, and we also asked for additional slots. So we ended up with 6 slots. Van Ingram from the Office of Drug Control Policy will be going. So we're very excited. That group's going to be a really cool group to go and start working on this collaborative. So we're very excited, and that'd be for 18 months. So just wanted to let you know that. But I think that's all I have to tell you right now about the reentry.
Perfect. That's all fantastic.
Yes,
I see Dr. Schuster came off mute. Do you have a question or comment?
Yeah, I would just let people know that there is a technical advisory committee of the for Medicaid, and it's on reentry. Steve Shannon chairs that, Priscilla, and it's open for people to join and listen in on that discussion. They meet every other month on the second Thursday of the month at 9 a.m. And if people go to the Medicaid website and type in reentry TAC, TAC, they can see when the next meetings are, and they can join by Zoom. So if people are particularly interested, that's a great place to get into the nitty gritty, and also to submit their questions and comments on it. So we want to have that feedback for sure. Thank you.
Yeah, that's a great comment. Thank you. And we'll put that in the chat if we can. I see Kelly working on it right now. So that's a great call out. Thank you so much, Leslie. Do you have anything else that you want to share about the reentry waiver?
Not right now. We're just very excited, and stay tuned next. One of the other things that, as you'll remember, we do have a component that we added for juvenile justice. More to come on that as well.
Perfect. Yes, we look forward to hearing a little bit more about that next time. All right. Well, let's go ahead and switch gears. We're going to move into NEMT regulations, and we have Medicaid Commissioner Lisa Lee here to talk a little bit about some of the NEMT regulation changes. You know, one of the things that we've heard across the state as we've talked to consumers is just the struggle to find transportation. And even more than that, even within Medicaid with non-emergency medical transportation as a benefit, the struggle to actually utilize it. There are lots of rules that make it really complicated for folks. And we're really excited to hear about some of the changes that the state has made to make it a little bit easier. So if Commissioner Lee can share some updates. What are those changes? Where are we in the process of those being finalized? And what does that mean for consumers?
Thank you, Priscilla. Very exciting news. We do listen to our members, and we do listen to our advocacy community, and we have made some changes in our regulations. One of the most significant changes is the vehicle in the household rule. So prior to us making changes, if an individual called to schedule a non-emergency medical transportation appointment and they had a vehicle in that household, whether or not it was registered to the individual who was calling, they were denied transportation. They could get transportation if they noted that the vehicle was used for work or for school, or if it was inoperable, but it was a little bit of a hoop to jump through. So the first thing that we did is change that vehicle in the household to be the person calling has to be the individual who is requesting transportation. If it's an individual who lives in that household, but that car is not registered to them, they can get transportation immediately. And if an individual calls for transportation, they can't just be denied right away. They have to be transported and given time to give documentation as to why they can't use their car if it's registered to them. So that was something we actually put into play during the public health emergency in COVID, and we've just codified it in regulation. Those regulations have passed out of the regulation review subcommittee, and they will be heard in June by the interim joint commission. And so we have already started seeing a decrease in the number of individuals who are denied transportation due to a vehicle in the household. So we're very excited about that and are going to continue to watch all of those watch air transportation numbers to see if that continues to decrease, and do everything we can to ensure individuals have transportation.
Yes, it's an incredible change. We've heard a lot from folks about that complication of having a vehicle that in the household, registered to the household, where they just still are being locked out of NEMT. So that's really exciting that that's being codified now. And you said that's being heard in July, right?
In June, I think it'll be going before the interim joint commission in June, but it has passed out of administrative reg review already. So it has jumped the first hurdle. So we're very excited about that.
Yes, that is really exciting. And we absolutely, to Emily's point in the chat, will, people, they don't always know about these rule changes. They'll try and use it one time and then they'll be locked out. Things will change and, they don't know to go back and try it again. So we'll need everyone's help who's on this call, their help trying to get education and the word out about these changes. So again, very exciting change there.
And if you do hear anyone, you have an example of someone who cannot access transportation, non-emergency medical transportation, a Medicaid member, if you would, somebody would just reach out to the department, we'll make sure that we can make sure that they have those transportation needs.
That's really helpful. We will definitely make sure to share that around because, you always hear stories from folks. And so having that offer to be able to help will be fantastic. Thank you. All right, let's just move on to Medicaid unwinding. So one of the things that we've talked about for the last year, it's been over a year now, wow, is the unwinding that's been going on. And the state has their monthly stakeholder meetings. We'd love to zoom out and look at the last year. What is the bigger picture of how unwinding has gone? How many people have been able to be renewed? How many people have been terminated? Are there any changes in the uninsured rate? All of the things just on a bigger picture level.
Yeah. Hi, Priscilla. Thanks, everyone. This is Veronica Judy Cecil with Medicaid, and it is hard to believe that we have now gone through 13 months of renewals as a result of the unwinding of the public health emergency. So our last, what we call the last of the first of the public health emergency unwinding renewals, that was May. Now that doesn't mean that we still have some processing that is going to happen. And in fact, for those of you who do join the stakeholder meetings and do check out our reports on our unwinding website, we have that 90-day processing report that we file. So the last report that we'll be filing for the unwinding will be on September 15th, and that will be the 90-day period following May renewals. So we're not done. We're still continuing to see, we have extensions, obviously, that are continuing renewal extensions that happen to give people additional time to respond to a notice. So those activities are still happening. And like I said, the last report will be in September. We do plan kind of looking back and doing a kind of final report on how many were processed. To your point, Priscilla, we have we share regularly each month what the renewal approval and termination numbers look like, but we do hope to accumulate everything into a final report. We still have those flexibilities that are continuing through June of 2025. I know one particular flexibility that folks have been interested in are the child renewals, where we got permission to extend child renewals by 12 months. And give them that continuous coverage that we were required to do by federal law. And so we are in communication with CMS right now on whether or not that's a particular flexibility that Kentucky will be allowed to continue. So we'll keep folks updated on that, but we just don't have a final answer on that particular one.
Right. So for child renewals right now, the way things stand, no kids unless they move out of the state, turn 19, pass away, or their parents contact EMS and say, hey, can't disenroll them from Medicaid. Outside of those 4 reasons, no kids in Kentucky should lose their coverage, period, right now. And that's at least the case until September, but it might be even further than that, depending on what CMS says.
That is correct.
Okay. All right. I like that message. That's nice and simple. Whenever child renewals do restart, are there any messages that you want to make sure that families, parents know, like what to look for, things to make sure to keep an eye out? Is there going to be additional outreach to families when that all happens? What's that going to look like?
Yes, absolutely. So as we approach, and if we do have to then reinitiate renewals for children, we will do a lot of outreach around this to make sure folks understand that they're going to have to go through an active renewal in order to be able to extend them the next 12 months. And so there will be a lot of outreach around those.
Love that. You all did so much outreach during the unwinding for adults with the phone calls and the notices and all of that. So I would love to see a similar campaign for kids, because we don't want to see any kids lose their coverage, and parents. I think parents are still very confused about the process, and there's still that miscommunication about parents thinking that since they're not eligible, that their kids aren't eligible. So we, want to be very intentional in making sure that we're targeting folks and getting them the information that they need and that they can understand what to do and how to make sure that their kids keep their coverage.
Yeah, we agree with that. And again, one of the things that we're kind of taken away from what we have done under unwinding is what can we just kind of put permanently into place. I think the outreach has been one of the better tools that in getting folks where they are, reaching out to them where they are to make sure they understand they're going through a renewal. Our providers have been extremely helpful. As a member comes in and maybe they've just been terminated, connecting them. We'd like to continue that beyond the unwinding. So our Salesforce campaign, which is the campaign that goes out there and texts and emails and notifies folks, we do plan to continue that kind of outreach campaign beyond the unwinding.
I love that. I love that. And I also really heard great feedback about those monthly stakeholder calls, about how informative they are and how much people enjoy hearing and seeing the data, because you don't always get to hear the actual numbers unless this is your job to focus on those numbers. And so it's a really good opportunity for folks to like really get a better picture of what's happening. So I'd love to see something like that also continue, especially at least through the child renewals.
I think we agree.
Love that. All right. Are there, do you have any like big picture data about, you know, the overall adult population, how many people were renewed in the last 12 months?
So I can say we still don't have the main numbers yet, because, you know, we're validating that data, and there are folks still in extension. So understand that we initiated a first renewal for post the public health emergency for 1,092,664 individuals. So that's a lot of people. And I think the really good news for Kentucky, 73% of those were approved. And so that's a really strong number. And so we've got 798,925, this is as of today, that have been approved of the 1 million that have gone through and initiated a renewal.
1 million renewals in 12 months is incredible. That's a lot of cases. Wow. And 73% is a really great number. For the other 27%, do you know, I know there were early numbers about employer sponsored coverage, or do you know where any of those, that other 27% went?
So we do know that of those terminated, it's around, on average, it depends on each month, but around 30% have other commercial insurance. So we can confirm that. We can't confirm necessarily employer sponsored insurance, but definitely that they had commercial insurance. And then, of course, what we've also been tracking is those that have gone on and chosen a qualified health plan, may be eligible for advanced premium tax credits. And so we can, again, you know, track some of the terminations going to the qualified health plan too. And we just hit over 80,000 people on the exchange, which is a great number.
And Veronica, like on average, didn't around 15% of the Medicaid terminations enroll in a qualified health plan?
That's correct. Yes. So as the Deputy Secretary mentioned, around 15%. So as you kind of whittle down, you know, how many were terminated, that relatively smaller number, you know, how many actually did have other coverage and how many moved to a qualified health plan. It's a significant number of those terminated.
Awesome. I love that. That's all great news, and overall a good job for Kentucky. I know it wasn't exactly smooth all of the time, but overall a really great job. So let's really quickly switch gears for our last topic, our dental vision hearing benefits, which are now permanent, or at least in place indefinitely, depending on how you want to say it. Can you talk a little bit more about the fact that they are permanent, and if you have any updated numbers of utilization?
Yes, so our regulations have the enhanced vision, dental, and hearing benefits for adults has been codified in regulation. So it has passed all of the chambers. It is on our website. We currently now this is for calendar year 2024, we have served 27,734 individuals, adults, in our dental program, 15,699 in the hearing program, and 128,411 individuals in our vision program with those enhanced services. And I think the last time I checked, it was well over, I think it was getting close to almost 200,000 individuals, adults with glasses that did not have glasses prior to us enhancing those vision benefits for adults. So very pleased with that progress.
Yes, that's incredible. Oh my gosh, that's absolutely life-changing for folks who didn't have classes are so necessary. Being able to see and hear and use your teeth is so important. So thank you for sharing that. We're kind of running out of time, so I'm gonna turn this over to Jessica. Thank you all for your time and all of this wonderful news related to Medicaid. So thank you. Turning it over to Jessica.
Priscilla, glad to be last but not least. So I'm Jessica Klein. I'm a policy associate with the Kentucky Center for Economic Policy. And I'm going to cover food assistance with our Director of Family Support Services, Todd Trapp. So I know we have some exciting updates to share today around a couple of different programs, but I wanted to kick off with a few reminders from the SNAP program, our Supplemental Nutrition Assistance Program. And I'm wondering, Todd, if you could catch us up on some of the supports provided through SNAP in response to recent disasters.
Sure, Jessica. So recent disasters, I think we're all talking about, at least what I'm talking about is the May 25th storms we had. I think there a whole lot of the state, probably almost every county in the state, had some wind damage and some power outages as a result of those storms. And so anytime a SNAP recipient household experiences a power outage for greater than 4 hours, and as a result of that, some food loss because of that power outage, they have 10 days from the date of that incident to request replacement of those lost food benefits. So that happened as soon as households began to experience that. We started getting requests in. Today would have been, I believe, the 10th day, if my count is correct, to make that request. We submitted a request last week to extend that 10-day time frame to 30 days and received approval on that this morning. So we're getting that messaging out today. We've gotten it out to staff in the field so they know that they can continue to take those requests and approve them appropriately as those come in. So that's the good news that I can share on the most recent storm damage. We're currently that's all we're doing response wise for those storms. We're going to continue to monitor that situation, and if things escalate to the level where we could operate disaster SNAP, DSNAP, as we call it in certain areas, we'll certainly move to do that. But that's where we're at so far, Jessica.
Thank you. And just as a reminder for folks, the best way for people to get that assistance and to make sure that they get the that extension, should they reach out to their local office? What's the best way for them to get that information?
The easiest way would probably be to use, I say easiest, relatively speaking, they can complete a replacement request via call services. So that's 855, let me see what it is, 306-8959. So they can make that request calling DCBS through call service. They could also make it in person at a local DCBS office, or they can make it through self-service. So any of those channels would be good.
Thank you. And a few additional reminders in the SNAP program we wanted to cover today. One is the supports that SNAP connectors can provide. Can you give us a little update on SNAP connectors?
Yeah, we launched the SNAP Connector project, I guess you'd call it, I believe in 2022. And they can certainly assist with an application. It's really just like a household applying through self-service, so they can assist with an application that way. They can also assist with some change reporting. These connectors can. Since its launch, we've right now, I think we have 17 different organizations that we partner with as SNAP Connector organizations, and across those we have 187 individual connectors across those 17 orgs. And so basically since launching in 2022, I think right now they're averaging around 308 applications per month. So that's been steadily climbing, as you might imagine. But that's where the average is now. We're always looking to add new connectors from nonprofits or other government partner organizations. We can do that either via a non-financial agreement or potentially a financial agreement. Either way, it'd be written into our SNAP outreach plan. Of course, if it's financial, it'll involve a contract. It's a little bit more involved process, but certainly either way, we're glad to entertain that. Megan Snow is the person who manages those, and I can, Jessica, provide you with an email inbox for any questions about that that you can share following this meeting.
Great. Yes, we will make sure that that ends up in the notes. Great. Well, in addition to connectors, the last thing we wanted to cover in the SNAP program was the recent changes through ESAP and the standard medical deduction. I'm wondering if you could give us all a couple of reminders about those programs.
Yes, that launched in October of 2023. And ESAP is the Elderly Simplified Application Project, is what that stands for. Essentially, it's SNAP. It's just a different group of SNAP based on certain eligibility criteria. So if a SNAP household contains if all the adults, let me back up and say it this way. If all the adult members in a SNAP household are either elderly or disabled, and there's no earned income in that household, then they will qualify for ESAP. And basically, nobody applies for ESAP. You apply for SNAP, and if you meet the criterion, you'll just be transferred into that group. And what that means is it's a good thing. It's essentially a lift for DCBS staff and for the households, because we're able to verify certain information using some of the interfaces we have. So that's a burden lifted from the households. It provides the households an extended certification period, 36 months, so they can receive SNAP for 36 months before they have to complete a recertification. And during that 36-month period, every year, every 12 months, we will send them a reminder, just reminding them what changes they're required to report. And it's essentially anything that would take them out of that, remove them from that ESAP group, at which point they'd be transferred back to regular SNAP rules. And then at the end of that 36 months, they do have to complete a recertification, but they don't have to do an in-person interview. And so even that process is simplified. Now, the benefit amounts remain the same as for the regular SNAP program. However, at the same time we implemented ESAP, we implemented something called a standard medical deduction. And through implementation of that, some of these ESAP households who qualify for that may see an increase from the regular SNAP. Regular SNAP households could also qualify for the standard medical deduction. Let me be clear on that. But that benefits both in that if a household has out-of-pocket medical expenses greater than $35, they can qualify for $137 monthly standard, which could increase the benefit calculation for their household. Now, if they have actual expenses over that 137, they can verify that every month and see that benefit in their calculation. But for the larger part of the group, the standard medical deduction is very helpful. And as I say, the result, shows that they get a monthly increase in their benefits. I think that's the update on ESAP, unless there's anything you think I missed, Jessica.
No, it's great to hear about those important programs to extend recertification and make sure people are getting enough benefits. So thank you.
So one more thing, I don't know, do we have just a minute to talk about summer EBT?
We sure do. Let's dive into summer EBT.
Yeah, I know we've talked about it before, but just the most recent update. I think a press release went out May 24th. So this really won't be anything new that wasn't in that, but summer EBT, it's not PEBT, it differs from that. There's no absence required, and it's a little bit different grouping. The very first issuance, the auto issuance, is slated to be June 17th. That will be to about 80% of the projected eligible student population. That group are the compulsory age students between the ages of 6 and 18 who have received during the school year at some point in time KTAP, SNAP, or kinship care. And so, as I said, that's going to be about 80% of the 450,000 students we think will be eligible. And that benefit will go out on the 17th, so it should be available as soon as the house, if they don't already have a EBT card, it'll be available to them as soon as they receive their card. And if they do, it'll be available on that, it'll be applied to that existing card they have. The remainder of those 450,000 students who are projected to be income eligible, they'll be able to apply beginning June 25th. The application should be available online, and we can provide that website too following the meeting, Jessica. And that application will be open from June 25th through August 15th. Now, after August 15th, the application will still be available, but it'll be for summer 2025. So that'll be an important learning point for all of us, that transition from one summer period to the next. So
yeah,
just
and I
wanted to
think
mention
that
that.
the good news there, though, is that it is continuing next year. So, yeah, more benefits to come. And I think one final reminder about that is that it's a one lump sum for the summer at $120 per student.
Correct.
Yeah.
That's correct. It's essentially $40 for 3 summer months, but it'll be issued all at once, $120 per student.
Great. Well, thank you so much, Todd. I think
Thank
the very last thing we have is a quick announcement around WIC. I'm wondering if Deputy Secretary, you have a minute to give us that update.
Sure. Just quickly. So in 2026, we are planning to add the Women, Infants, and Children program, otherwise known as WIC, on the Connect portal. So this way, people, when they're looking to apply for Medicaid, SNAP, TANF, or childcare, they can also apply for WIC benefits. And, we haven't worked everything out yet. It's still in kind of like the development stages, but what would occur is basically, the Connect portal would determine their financial eligibility for WIC, verifying that they have income up to 185% of the federal poverty level. And then an electronic referral, would be made to their local health department, let's just say like in Franklin County. So all they would have to do is go to the local health department and have their nutritional risk assessment. So we're really excited about this. We'd like to make all things Connect as a one-stop shop for people.
Well,
Thank
thank
you so
you very
much.
much for that exciting update. I have to say, thinking back to those guiding principles that I mentioned at the beginning of our call, this really is one of those areas in which we can make such a huge difference when we work on that integrated, seamless system where people can go to access all of the different kinds of benefits and services that they need in one place, and make it, as easy for them as possible. And we see how many Kentuckians not only need these services, but are taking advantage of them. And that's a great thing because it means that they're healthier, they're able to take care of their families and be, contributing to their communities. So thank you all for the work that you do at the Cabinet for Health and Family Services and for taking the time to talk with us today to share these updates and answer questions. We really appreciate it. And I hope to see many of you at one of our roadshow stops, Advocacy for Thriving Communities this summer. Our next webinar where we'll do state and federal updates, and our next forum will be this fall. So I think there's an evaluation link in the chat, and you'll get links to registration for the next webinar and forum. But until then, we'd like to see you on the road this summer. So thank you all very much.
Thank you.
Appreciate it.